very, very much. And thank you all for being here today on this very, very important day. 30 years ago, Arizona became the last state in the nation to establish a Medicaid program. Our system, which we call Access, put to work the lessons of each of the states that came before us. Access is based upon a conservative, free market principle. In this managed care system, private health plans compete for contracts. This keeps prices down and services efficient. In fact, an average cost for Access members are nearly $700 less than the national average. Arizona voters have consistently supported this program and have twice voted by wide margins to expand coverage for the working poor in our state. Today, I'm proud to announce that we have crafted a thoughtful, conservative legislation that honors the will of the Arizona voters. What's more, this Medicaid Restoration Plan will bring $8 billion into our economy over the next 4 years. It will throw a lifeline to a safety net in rural hospitals struggling with the cost of caring for the uninsured. And it will keep Arizona's tax dollars here at home, rather than allowing them to go to Washington to be spent on who knows what. Best of all, my plan comes at no cost to our state general fund. Each of these things speak to the policy of this decision. But there's something even more important at stake today: people. I'm talking about the tens of thousands of our fellow Arizonans who've lost jobs and their health insurance during the Great Recession. I'm talking about the thousands more who continue to work but simply don't earn enough to afford private insurance. If you're one of these Arizonans and you don't have children, you're currently locked out of our Access program. They walk a daily tightrope, knowing they are one car accident, one freak injury, or one serious illness away from disaster. When they absolutely do need care, the hospital emergency room is usually their only option. This is not just the most expensive option for taxpayers, it is the least effective way to treat a chronic condition like cancer or diabetes. So the patients get sicker and the rest of Arizona pays for it. Failure to adopt my Medicaid Restoration Plan not only endangers these Arizonas, it puts at risk more than 50,000 others who currently have Access coverage. Without action by this legislature, they will lose care at the end of this year. Regardless of whether they are currently receiving life-saving treatment like chemotherapy or dialysis, they will lose care. I have always been proud to be a member of a pro-life party. With this legislation, we're talking about people's lives. We're talking about saving people's lives. I'm a pro-life governor. I refuse to stand by and allow this many people to needlessly suffer, especially when we have a solution. That's what, thank you. And that, my friends, is the solution. I wish I could put a big emergency on it. And that's why I am so honored today to be here, joined by this broad and diverse coalition representing more than 110 organizations across Arizona. Business leaders, doctors, nurses, county sheriffs, the Catholic diocese, university regents, mental health professionals, and more. What they all have in common is their desire to see the Arizona legislature join me in enacting this plan to restore Medicaid coverage, boost our economy, take pressure off our state budget, and provide cost-effective care to Arizonans who need it the most.